Welcome friends to this episode of CNS Viewpoint. Today we are going to talk about an important news I read in end September 2021, and this was about that the government has allowed a doorstep or vaccination at the homes of those who are disabled or living with disabilities, persons with disabilities, or those with restricted mobility. This is September end 2021. Even if it is 9 months late, but these kind of policies should have been there right from the very beginning. Actually, these kind of flexibilities and these kind of approaches, where we ensure that the health technologies, health services are reaching everyone in need, and those who cannot go in person to these services due to a range of socio-economic, behavioral, and a range of reasons. Then the services should reach them, and there cannot be one size fit all. And these kind of approaches, where we take into account unique needs, special needs of different populations, different communities, different regions, different contexts, is definitely this is the best approach forward. This is a very positive ray of hope that the government has itself announced, that the doorstep or home vaccination for people who have are living with disabilities or have restricted mobility. So and I do hope that more such measures will be taken and announced in consultation with in the leadership of the very communities themselves, because people who are living with these specific conditions in different contexts, different realities, socio-economic, behavioral, gender, there are so many different parameters you can look at. They are the best ones to come up with solutions of what will work for them, and most likely they might be probably the best people to should not only suggest us the best solutions that will work for their own communities, but also probably play a very proactive role. And such approaches has worked, friends. For example, the transgender services and programs of the government of India involve people from transgender community. People living with HIV have been involved at every level, perhaps at least in the policy level. And I do hope that it is reflected in the program level also, although I have seen it definitely is reflected in many committees and services. I find people living with HIV are part of those processes, as well as those services themselves. But of course it is not an ideal situation, and of course a lot more can be done. But this is certainly a very big way forward, that it is not a provider-driven vaccination program for COVID, but it will also tailor and respond to the unique and special needs of different populations and communities and contexts. And let us hope that this approach is also without delay. These approaches, these gold practices are also adopted for every other aspect of health responses, whether it is tuberculosis or HIV or non-communicable diseases such as cardiovascular diseases, stroke, cancers, diabetes, chronic respiratory diseases, mental health issues, Alzheimer, health and social welfare needs of the senior citizens, or especially women, or any context, any community, any population across the world. So with this hope, I'll conclude today's CNS Viewpoint, that our health services will reach, public health services will reach every single person in need, every single person on the planet, and in a socially just and ecologically sustainable manner. And there will be no place for privatization or profit minting, or those who who has made profiteer out of illnesses and deaths. So with this hope, I'll let us conclude today's CNS Viewpoint, and tomorrow again we will be back with our thoughts and views and perspectives and analysis on some other issue 5 p.m. India time tomorrow. See you then. Bye bye. Stay safe, stay healthy, and think how you can ensure health services reach your community in more unique, innovative manner, and what role we all can play. Thanks. Bye bye.